Hi, Matt. How are you today?
I'm good. How are you?
I'm good. Okay, so I see in your chart that you're here because you're having some back pain.
Yes.
Okay, could you tell me a little bit more about that?
It's kind of like in the middle, I would say.
Okay.
It goes up to my neck,
Okay.
and it's a lot of it on the right side.
All right.
I've been having it for the last year, and it doesn't go away with medication or anything like that.
Okay. And I'm seeing in your history that you were here last year because of some joint pain. Are you still having that too?
Definitely.
A little bit. And is it still in the shoulder? And
Mm-hmm.
Okay.
And the hip.
Okay. Sorry about that.
No, it's okay.
Do you remember anything that happened that would have incited the back pain?
Well, I'm a waitress, so I
Okay.
do walk a lot. I'm on my feet a lot.
Okay.
And sometimes I have long shifts.
Okay.
We recently did like a 12-hour shift, and it ended up being 13 hours.
Wow.
Also, the heavy lifting of the trays, it's kind of hard on my
Yes.
back, I guess, and my shoulder.
Sounds like you need a lot of rest. Yeah.
I was wondering, would you be able to write me a notice, a work notice, where I can stay home a few days?
Absolutely. I would be willing to do that for sure. I think that definitely qualifies as a strong case for that. So what about your shoes as well? Have you changed shoes? I mean, that's a minor help, but it could help if you were to get more comfortable shoes.
No, I have just some running shoes that I wear, and they
Okay.
have to be a certain color, so it's really hard to find good shoes that
I'm
are
so sorry.
that color.
Okay. So do you sleep a lot at night?
I do sleep, yeah, I sleep
Okay.
good.
All right. How's your mattress?
It's on the softer side. I do prefer on the
Okay.
harder mattress, but my partner just likes to sleep on this mattress,
Okay.
and we're trying to find a
Okay.
new one that would
Okay.
fit both of us.
That's not ideal for you. Yeah, probably finding somewhere in between. There's also those sleep number beds where I know they're expensive, but you can control the firmness of the mattress on each side. So something to think about maybe for a Christmas present or something like that.
Yeah, those are very expensive.
Yes, I heard. So I'm going to start by palpating your neck and shoulders and back, and then I'll be checking your joints, and then I'll be moving on to your back, and I'm going to see where the muscle masses are that are more stiff, and depending on that, I might do some cupping therapy, I might do some acupressure. We're just going to see, okay?
Okay.
All right. On a scale of 1 to 10 right now, how's your back pain?
It's a 4.
Okay. Okay. Okay, I'm just going to start by palpating your neck and your shoulders, so just try to relax. Okay, noticing a lot of tightness right here. Dorsi major. Pain here?
A little bit.
Okay. How about here in the neck pain?
Yeah.
Sorry.
It's okay.
So there's pain here?
No.
Okay. Pain?
No.
Okay. What about right here? Pain?
A little bit.
Okay.
It's a lot worse on the right side.
Okay. I'm gonna go ahead and look at your joints and your hands. Just
If you want, I
palpating.
can remove the
Okay.
watch.
I think that would help me. Okay. Yeah, I felt a click here. A lot of tension. Are you left-handed?
No.
Okay. What about your palm here when I press down? Is there pain?
A little bit.
Okay. So it seems like the symptoms from last time haven't really gone away that much. Maybe you've gotten used to them more. But the back is new. Go ahead and just palpate this side. Go ahead and rest your arm. Starting with your neck, pain here. Okay.
Yeah.
Okay, so that's really bad.
Mm-hmm.
It's the upper back. I'm noticing just a lot of tightness. And just muscular inflammation all over. Okay. Okay, I'm going to ask you to do a few simple movements. We're going to start with this arm. Okay, so if you could go ahead and reach out all the way slowly, slowly. Okay, and did you have pain in that one simple movement?
No.
Okay, bringing it down. Okay, now I want you to go all the way back this way. Okay, pain here?
No.
Okay, all right, and then upwards. And here?
A little bit in the neck.
In the neck area? Okay. Yeah, I'm seeing a strain here. Definitely. Okay. Go ahead and put your arm here. Now try to bend your arm into yourself. Pain?
No pain.
Okay. All right. So I'm going to have you do those movements again. This time I'm going to listen to your joints to see if I can hear any activity. Okay. So, and I'm going to be guiding your arm too. Okay. Okay. Alright, a little bit of crackling here. Go ahead. Mm-hmm. It's a lot of strain. I'm hearing just a lot of creaking. So go ahead and move your arm inward towards yourself. Okay. And if you could just do a simple rotation with your wrist, like so. Yes, try to keep your palm up and just move it like this, back and forth. Okay. Not so bad in the wrist, which is good because we use our wrist for a lot of things, and this is your right hand, so go ahead and do the same thing. I'm just going to listen on the other side. Okay. Alright. So, if you could extend your arm again all the way, okay, and you're going to grasp your hand. I want you to try to pull it in towards yourself. 3, 2, 1. Just bring it, okay? Okay, good. Any difficulty in doing that?
No.
Okay, this time I want you to lead with your elbow, bringing it in. So I'm still going to grasp your hand, and I'm going to resist your push. So 3, 2, 1. Just bring your elbow down.
It's shutting down the shoulder.
Sink down the shoulder, pain. Okay. Would it be here in the front shoulder or towards the back?
Front.
Okay. All right. And now keep your arm extended if you can. This time I want you to move your arm inward towards yourself. 3, 2, 1. Okay. And outward towards me. 3, 2, 1. Good. Okay. Did you have difficulty in doing that?
Same in
It seems
pain.
very strained. You seem to have definite muscle weakness, and I think it's due to the pain. So now try to, we'll give you a rest here in a second. Try to lift your arm up. 3, 2, 1. I'm resisting your push. Okay, and lowering it. 3, 2, 1. Okay, all right. So I'm just going to be doing some percussions, just trying to feel for any signs of swelling to give me a better idea of where the muscle mass is. And if any sharpshooting pains come up, let me know. In doing this, you should just feel a light pressure, so it's important for me to know if you're having anything above that in terms of pain level. Okay. Down. Okay, I'm just going to look here. I just want to get a closer look. So go ahead and rest your arm. Well, your reflexes seem normal. I'm not sensing any major swelling. Have you ever been to a neurologist for this? No. Okay.
Never.
There's a possibility that you're having some nerve damage. I'm going to, there's definite tension in the muscles of your back, that's definitely there. But the shooting pain down your arm and shoulders when you do simple movements, that might be an indicator of nerve damage. So I can definitely send you to a referral for that. Okay. All right. This is good. I'm just going to take a look at your hands. Okay. So I'm just going to move your fingers up and down. Let me know if you feel pain. All right. One more exercise for me for this arm, just with your hand. I want you to make a tight fist, extend, do that 3 or 4 times for me as fast as you can. Okay. Any pain there?
No.
Okay. I'm going to go ahead and look at the other side, okay? Okay. So. Okay. So I'm going to listen to your joints on the other side as you make simple movements. Go ahead, just up and down. Okay, and back. Okay. Not as much creaking on the left arm. Okay. And go ahead and extend back again. And do the rotation with your fist. Just like this. Just move it back and forth. Okay, very nice. Alright. Turn, do the same rotation. Okay. I'm feeling a little bit of strain here. I'll write that down. Okay. Now, same thing here. I want you to go ahead and extend your arm all the way. Okay, try to bring it inwards towards yourself. 3, 2, 1. Okay, good. Try to bring it outwards towards me. 3, 2, 1. Okay, good. And try to bend your elbow backwards like this. 3, 2, 1. Okay, backwards towards yourself like so. 3, 2, 1. Good. And forward. 3, 2, 1. Okay. Keep extending your arm. Trying to move it down. 3, 2, 1. Okay. And upward. 3, 2, 1. Good. Now I'm going to have you bend in towards yourself. Try to push against me. So try to extend your arm out. 3, 2, 1. Okay. This is a little bit stronger on this side. So try to extend in towards yourself. 3, 2, 1. Okay. Very good. Okay. One more. Just extend your arm again. Okay, and I'm going to grasp your hands. Try to move against me. So try to move your arm back. Like this. Okay. Very good. Alright. So I'm going to just do your reflexes now. The irritation on the right side, at least for your arms, is a lot more pronounced on the left side. Okay, I'm going to go ahead and look at your knees and your feet, okay? So let me ask you before I check, are you having any knee pain right now?
No.
Okay. Okay, so you were last time, so I'm just going to do an abbreviated check there. It sounds like most of your problems are from the upper part of the back, but sometimes it's a sneaky way that things that kind of stem from the knee can affect the upper back, so I just want to rule that out, okay?
Definitely.
All right. Okay. Your kneecaps are strong. I'm not sensing any pronation or descension of the lower kneecap. So that's good. I'm just going to gently do some movements. I'm actually going to take a listen as well. Very good. Okay, no abnormal sounds. I'm going to listen to the ankles too, just doing some simple movements. Okay. Going to listen to this knee as well. Just let my hand guide you. You don't have to do anything. Okay. Okay, seems very strong and healthy. Okay. All right. I want you to try to push your legs out towards me. 3, 2, 1. Good. Now try to push them behind you. 3, 2, 1. Good. Now try to push them outwards like you're spreading your legs. 3, 2, 1. Oh, that was very strong. Okay. And now inward. 3, 2, 1. Okay. Very good. All right. Okay, I'm just looking. listening here to make sure your toes are healthy. There's no extraneous joint issues occurring with the metatarsals. Okay. Okay. Okay, and try to point your feet. If you're a ballet dancer, point them downward. Good. Now try to lift them. 3, 2, 1. Against my push. Very good. Try to point them again. 3, 2, 1. I'm not going to let you do that. Very good. Okay. So I think your feet and knees are healthy, so we're going to just go ahead and end that section there.
Okay.
And we're going to move on to your back.
Okay.
I'd like you to lay down on this bed. I'm going to do some spinal tracing and measuring to make sure that your spine is aligned.
Okay. Thanks.
So I'm going to be tracing along the discs of the spine and doing measurements just to measure for general symmetry, okay? So I'm just going to be basically tracing over the natural circular discs. Okay. Measuring to each side, that's 7 inches. 7. It's not symmetric. Okay, and going up. 6.5. Wow, okay, that's 7. So there's a deviation. On the top, that is 6. And that is 6.5. Okay. Measuring the next 3, starting with 1, 7.5. Starting with this. That's 8. So it seems to be a ½ inch deviation. I'm going to note that. On the 4th disc as well as the 2nd. Okay. And this is 7, and this is 7, so we're turning to normal. The 5th disc. Let's take a look at the 6th. Okay. 7 inches. Okay, that's 8, so this is a full inch deviation on the 6th disc. Okay. So, definitely some abnormalities here. Not enough to indicate scoliosis. Here. Okay. 7th. 8th. And 9th. I'll be measuring here. That's 9 inches. 9 inches, so the 7th disc is symmetric. Okay. Inches, 8.5, so that's a ½ inch deviation on the 8th disc. Okay, 7th. Okay. Perfect symmetry on the 7th disc. And we'll go to the 13th. Okay, these look to be a little bit better. Okay, so the issue is that your spine elements in the center are just slightly off, and that's probably due to the strain of the muscles of the back. I'm going to take a few last measurements before we move on to the treatment. Okay, that is 9 and 9. So perfect symmetry on the 12th. Okay. The 11th, or that was, okay, 8 inches here. And, okay, so if we, that's about 8.2. So perfect symmetry on the 11th. And one more. Okay, so we're going to measure the 10th. That's 9 inches. And 9 inches, so that's good symmetry. Okay, so just some mild misalignment here. Okay. So I'm going to take this arm real quick. I'm just going to have you bend it back here. I'm just going to palpate the scapula, and that is where the muscle tension is coming from the scapula to the center of the spine. Okay, let's do the other side, if you can. Thank you. And scapula is definitely protruding. Yes, the scapula to the center, that's where I want to focus my treatment on. Okay, so I'm going to be doing some cupping therapy, okay, just to stimulate blood flow and really even out that muscle mass that I identified, okay? Are you okay with me applying some oil to your back?
Yeah.
Okay, great. This is a menthol based. Just gonna wipe that marker right off. And with the cupping therapy I do, it's gonna feel like more of a massage. I like to, instead of keeping the suction right here stagnant, I like to move it around just to really stimulate movement, because the problem is as your muscle kind of clings onto a mass and holds it due to stress, it stops moving, it stops blood flow, toxins build up in your system, and I am trying to, or I am endeavoring to just drain it. So that's what I'm doing. I'm just draining the toxins. It should not feel painful. It should feel like a release. I'm starting with a larger cup. Then I'm going to move on to one that's just about the size of your spinal disc, so very tiny. And I'll be zeroing in on the individual discs, really trying to simulate movement. You're going to feel red for a few days after this. That's completely normal. It's actually a sign that the treatment is working. Okay. How does it feel right now? Okay. So I'm seeing you are getting a little red. Your back's getting angry. It's definitely trying to release that tension. That's a good sign. Just like in life, with our feelings, if we don't let our tension out, it has nowhere to go and it kind of festers. So we need to just anger it a little bit, let it out, and that's the process of detoxification. Move a little bit up towards the neck. I'm also going to get your shoulder area because that's where a lot of your pain is. I'm not going to go too hard on the neck and shoulders just in case there is a damaged nerve. I don't want to apply too much pressure to that area because it could inflame the pain and it could make it worse. But I am just going to gently glide over it because the muscle tension has kind of spread to that area. There we go. Nice release of tension. Okay. Okay. Moving on to a smaller gua sha. Starting from the spinal discs and just spreading out any unevenness. All 13 discs that I measured are within the range of normal, but there's some irritation, there's some misalignment. Okay. 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 I'm just smoothing it out with the gua sha. It's going to be a little cool. I'm going to be going gently. You're taking nice deep breaths, which is very good. Let me know if I'm going too hard.
No, it's good.
Okay. Okay, Pet P, so this concludes our treatment. I'm going to meet you out front and give you that referral. We're going to discuss exactly what I found here today, but I pretty much described it to you. I want you to get checked by a neurologist because I think that it's really important to rule out any major nerve pain. But I think that you're going to be just fine if you maybe come in for a few more treatments, and especially taking time off of work.
Okay.
I think that's the most important thing. I'm going to write you a note that medically you need 3 weeks off.
Thank you.
Okay, and I want you to enjoy that time.
I will.
Relax. Just try to take it easy because you work so hard, you deserve it.
Thank you.
Okay. All right. Get up on your own time, okay?